the show on the road. So, of course, task 8, discussion 8 is due. Lesson 8, don't worry, everyone gets credit. Because the link is bad and I don't know. It's one of those lessons that are kind of iffy in the first place. So don't worry about if you haven't done lesson 8, please don't do it. It's okay. Task 8, discussion 8, of course, is due today. I'll catch up on grades over the weekend. This is week 9, September 28, 6 p.m. This is MED110, 5NAX, typically meets on Tuesday evenings. And what are we doing today? Now, homeostasis 2. We're going to be talking about acid-base balance, buffer systems, which are systems how to maintain the homeostasis for acid-base, the renal regulation of acid-base balance, like how does our kidneys, throw out acid and base to keep everything all in line. We're also going to deal with acid-base, a little bit of acid-base disorders, because this is a high-valued topic for your future pathology class and for your NCLEX as well. There's lovely quick notes here regarding homeostasis and pH right here in your task 9. Now, next week is our final exam. If you wish to partake on the missing lab for today, please give me a call. It's scheduled. Nope. Put you on mute. Okay, now that I got some of you, let me write down who's in. Miss Louise as well. And again, my apologies, but I was hoping my symptoms would go away, but they didn't. They actually got worse. And nowadays with the common cold, our COVID protocols state that I cannot be on campus if I'm symptomatic, and I'm definitely symptomatic. And it's just a little cold, but again, to an immunocompromised person or to other immune compromised people in the building, we could be putting them at risk. So clearly states I can't be on campus. So, and also just to be on the safe side, our final exam is supposed to be on campus, but just to be on the safe side, next week is final exam. It will be done online, just like the same format that we did for our midterm. So the exam will be, there's no Zoom session for next week. The exam will be in the announcements and it'll be posted by 6 p.m. Next week. And I believe next week is October 5, if I'm not mistaken. And by 7:15 p.m. Next Tuesday, hand in shoot an email, of course, and all the instructions will be there in the announcements, and it'll be just like the protocol and the way we did our midterm as well. All right, and am I sharing my screen? Is that what's happening? Because if you guys are able to draw on my screen, that's kind of weird. But hey, it's okay. I've never seen that before. But hey, I don't know if you can erase it, whoever drew on it. I don't think I can erase it, but that's all right. So let's go into acid-base and acid-base disorders. So we're going to be dealing with pH. We're going to be dealing with acidosis, which is abnormal condition of too much acid. Alkalosis is an abnormal condition of too much base, and its compensations, right? And then how does your body perform homeostasis and correct itself? And this is a big thing because when we're in the hospital, this is how we deal with this. Is there's a reason why I put an IV in you, and this is one of the main reasons. Let us go to chapter. Well, before we even begin, let's just talk about Oh, acid base. So if you look at a pH chart, let's look at a nice, let's find ourselves a nice pH chart right here. And let's take it. Maybe I can do a better image, maybe a bigger. There you go. And I can take this image. I put it on this. Okay, I see that there are people on campus, but make sure to write your names in the chat so I make sure all of you guys get credit for today. When we look at this pH, I don't know how I can get rid of this. How do I get rid of that yellow? Or whoever wrote on it, like if you can somehow erase it. I don't. This is the weirdest thing I've ever seen. I've never seen how a student can write on that. Well, let's just muddle through it. So when we're looking at a pH scale, 7 is neutral. For human beings, it's around 7.4. So it's in the middle. And what does pH mean? pH actually means, let me write it down here. pH actually means the negative log, or logarithm, of the concentration of your hydrogen ion. What does that mean? For all you non-chemists out there. So that's what pH means. Negative log of the concentration of the hydrogen ion. That means if your pH scale is closer to 1, you have lots of H plus, hydrogen ion. And we all know that ions are highly reactive. That's why you have a slightly acidic substance here, like milk or coffee. I pour that on your face, you're just going to get pissed off. You're not really going to get hurt. But what if I put apple juice or lemon juice in your eye? It's going to start to hurt, wouldn't it? It's going to start to react. And definitely if I pour gastric acid on your face, it'll definitely react with your face and start eating your face away. So that's the reactivity of an ion. And the closer you get to the pH scale of 1, the more reactive it is. And the gastric juice or the juices inside your stomach are highly reactive. They're usually at a pH of 1 to 1.5, around there. So that means it has a lot of hydrogen ion. It's highly reactive and it's acidic. So milk, pH of 6, mildly acidic. Gastric acid, pH of 1, very acidic. Now, on the opposite end, when you get closer to a base, the ions of base or an alkaline would be hydroxy ion, and hydroxy ions are negative. So you have like an egg or baking soda, which is mildly basic. And another word for basic is alkaline. Draw it here. I'm using my mouse. Alkaline, as in alkaline batteries. It's another word for base. And that means whatever substance is on the right side of this scale has a lot of hydroxide ion. So an egg, baking soda, hand soap, mildly alkaline, mildly basic, mildly, it goes mild OH minus or hydroxide ion. But if I had like bleach or what's a really like a pH of 13 is like, you know, the heavy duty cleaners, especially if like Easy Off, it's like not Easy Off, what's it called? It's an oven cleaner. Like the old school oven cleaners from the 70s and 80s are very basic, very alkaline. So if I poured any of that stuff on your face, or I poured bleach or ammonia, which by the way, do not mix. If I poured any of this on your skin, it would start to react, and it would react poorly because it is a hydroxide ion. It is very reactive, just like it's in the other side of the spectrum. Now, when you look in the middle, if I add H plus and OH minus together, I get H2O. And H2O in chemistry is water. And coincidentally, we are made up of 2/3 of water. So this is the scale of what we have inside our bodies. And it should be in the middle, around 7.4, because we're mostly made out of water. And that's what the pH scale is. Closer to the left side, more acidic. Closer to the right side of the scale, more basic or alkaline. So if I had a pH of 11, my blood or my body fluids will be very basic. If I had a pH of 4 or 3, that means the fluids in my body would be very acidic. Okay, so that's the worst I could do to you regarding this this photograph. Now, we're going to talk about buffers in a minute, and a buffer is either a weak acid or a weak base that will keep my body somewhere in the range of 7 or a pH of 7.4. So, for example, okay, so what am I doing? Let's say, for example, I'm here at pH 5. I'm a little bit on the acid side. So my body is going to have a weak base that'll now move my pH closer to the middle. Let's say, for example, I have a pH of 10. My body is going to take a little bit of a very weak acid and then do what? Mix it and move it towards the middle, because that's what homeostasis is. I just want to be in the middle. I want to be in balance. And that's what buffer systems are. Let's I don't want to insert. I want to draw something. I'm going to write something down. So what a buffer system is, and we're going to show you, is either a weak acid or a weak base that will move wherever our blood is, or our body fluids. If it's in the wrong place, it'll move it. So for example, if I'm a little bit acidic, a buffer such as a weak base will move me a little bit towards the middle. If I'm a little bit basic and my body will have a weak acid, and it's going to move it a little bit towards the middle. And we're going to identify what those are, but I'm going to give you a little preview. Maybe you've heard of Ringer's lactate or lactic acid. That's a weak acid. Or a sodium bicarbonate, which is a weak base. And you've heard that a lot, you know, on maybe you were in the ward, or maybe you were in TV, you watch a medical TV show and they put Ringer's lactate in your IV line, or they put sodium bicarb. And what am I doing? I'm doing that so I can bring the pH of my patient towards the middle. And that's the goal of what we want to do. So let's go back here to chapter, what was it, 24? 26. So let's go to our chapter 26. Hey, that's weird. My instructor bio changed back to the default. Oh, because I'm in the wrong thing. It's term 5. Let's go to term, this is 5DAX, term 5. I want 110, 5DAX, 5NAX. So we go into chapter, there's our textbook over here. Is it chapter 25? let's see. So that's a big thing, acid base. Because if my patient's too much to the right or too much to the left, too acidic or too basic, it's going to mess with a lot of the chemical processes in my patient's body. And you're going to also see how it's going to mess with the kidneys and also mess with your lungs and lung function. And vice versa. If you have a kidney problem, you're going to have a pH problem. If you also have a breathing problem, you're also going to have a pH problem. 25. Oh, 25 was kidney. Body fluids, acid-base balance here, 26. So we already went through the scale of what pH is and what pH actually means. And now we know what buffers are. Buffers are either mild acids or mild bases that will help bring your body fluids back to around the pH of 7, around 7.4, which is what they call physiologic pH. Okay, so proteins can serve as buffers, not all of them, but some of them. And one of the big ones is hemoglobin. And hemoglobin is the hemo, meaning blood, globin, protein. That's the protein that's in the middle of your red blood cell. And they move CO2 in and out of your body, which the lungs also move CO2 in and out of your body, which also messes with pH. Remember, if you have, because pH is affected by kidneys chemically and by your lungs playing around with CO2 and O2 levels. Now, if you can see here, hydrochloric acid is a strong acid, and the phosphate buffer is a weak base, right? So sodium phosphate can be used as a buffer. I also mentioned bicarbonate, sodium bicarb, right? NaHCO3 is also a buffer. Now let's go into regulatory systems. Acid-base homeostasis. Now, if you have too much acid, of course, you have acidosis. Therefore, your pH is decreased. If you have alkalosis, your pH is increased. Now, this is the reaction of your how your lungs and your respiratory system messes with pH. So if you have a low pH, it stimulates the brain, of course, and then you're going to have increased respiratory rate because it wants to move the blood CO2 out of your body. Okay? So if you're acidotic, you're going to start breathing faster. When you breathe faster, you push out more CO2, and what will happen to your pH? It will go back up. Now, if you have alkalosis, that means your pH is high, like 10 or 11, right? Your brain then senses it, and then what's it going to do? It's going to slow your respiratory rate, increase your blood CO2, increase your bicarbonate, and then what's going to happen to your pH? It's going to go down. Okay, so this is a nice chart, and a lot of your future pathology questions and also your the questions for your final can ask things like that. If my patient has a decrease in pH, they have acidosis. If they have an increase of their pH, they have alkalosis. What is the respiratory compensation if my patient has an increased pH or alkalosis? Their respiratory rate will decrease. If my respiratory rate decreases, I'll hold CO2. If I'm holding CO2, that means my blood CO2 will go up. Blood bicarbonate will also go up. Now, what will happen in acidosis? Respiratory rate will increase. Blood CO2 will decrease. Bicarb decrease. And what's going to be the compensation? It's going to bring the pH back up and back up towards the middle where it belongs. All right. That's a beautiful, nice little synopsis on the respiratory response to either acidosis or alkalosis. Now, renal. What does the kidneys do for us? Well, when goes, if you see here, there is a counter exchange in our kidneys between sodium and hydrogen ion. Now that makes sense because if there's an interchange between, like if I take in sodium, I got to throw out hydrogen ion. And if I throw out sodium, I'm going to take in hydrogen ion. So if sodium ions are reabsorbed, right, then your urine is going to start throwing out hydrogen ions. And if you have too many hydrogen ions, right, it's going to start throwing out more hydrogen ions and therefore bringing back your pH to regular values. And that's what's that's what is an important feature of our kidneys. They not only, of course, make urine, they also can throw out salt and they can throw out hydrogen ion, which is important in maintaining your acid-base balance. So if your kidneys aren't working, that's not good. You won't be able to maintain balance. And look at this, ketoacidosis. If you have diabetic ketoacidosis, your body's making way too many ketones. Your ketones are highly acidic. They're not only ketones are not only neurotoxic, which is bad. It'll put you in a coma. If it also promotes acidosis, and that's not a good thing because we already know you need to be in the middle. You need to have a pH 7, and acid is what? Towards the pH of 1. And this is a major issue with diabetic kidney, because the kidney cannot, the diabetes messes with your kidney, and then you have diabetic nephropathies. And by the way, it is now moving to be the #1 preventable cause of kidney disease is diabetes. So if you take care of your diabetes, you should be able to forego what do you call that? Kidney problem, future kidney problems. So you could see here. Let me see. That there is a respiratory, your lungs, and what's not showing here is your kidneys, and there is a you have a respiratory system that will deal with your acid base, and there's also the way to deal with your acid base chemical system, and that's through your kidneys. Okay. Now you could sit and for your future reference, you could sit and try to memorize these, but knowing that if I'm either acidotic or alkalotic, it doesn't matter. I'm on the two extremes. So I'm going to have problems no matter what. And the goal of our management is to get the patient back to a pH as close to 7.4 as possible. Now, you could see how metabolic problems can cause metabolic acidosis and blood problems. For example, if you have diarrhea, you're going to be throwing out a lot of salts. You're going to be throwing a lot of bicarbonate, and it goes make my patient acidotic. If they have uremia or kidney problems, right? Again, metabolic acidosis. We already know DKA, increased ketone bodies, and ketone bodies are not only neurotoxic, they're highly acidic. If you work out too much, lactic acid, you know that cramping you get when you work out like too hard, or maybe it's like your first week back at the gym? That's lactic acid. Lactic acid in small doses is a buffer, but if you keep on working out and keep on breaking down muscle, it forms enough lactic acid where it starts to hurt. And of course, exogenous chemicals like drugs. So if I put isopropyl alcohol in you, ethylene glycol, and of course aspirin. ASA or acetic acid is aspirin. It's very acidic. It's the reason why we don't like prescribing it anymore. It gives a lot of digestion problems because your stomach is already acidic. It's better to give an NSAID like Tylenol or ibuprofen because it doesn't mess with your acid-base balance. But aspirin, salicylates, definitely mess with it. So how do we do compensation? Okay. So let's do respiratory first. Respiratory acidosis. Okay. I become acidic if I have way too much CO2 in my blood. Okay. So if my patient can't breathe very well, let's say they have any problem with their respiration, like chronic obstructive pulmonary disease, right? Like emphysema and chronic bronchitis. They will hold CO2 because they're not breathing very well. And if they're not breathing really well and they hold CO2, CO2 is associated with hydrogen ion, and it'll create a problem of acidosis. Respiratory alkalosis, it's the exact opposite. I keep on throwing CO2 out, but I'm throwing because due to my respiratory. So if I have anything like elevated respiratory rates, like hyperventilation, anxiety states, drug abuse, because all of that increases if you take any amphetamine or cocaine derivative, right? That has high levels of catecholamines, epinephrine, and norepinephrine. Things like cocaine and meth, right? That'll do it. And of course, a whole bunch of salicylates, you're going to have respiratory alkalosis. Okay. So think, if I'm breathing fast, I'm throwing out CO2, I'm throwing out hydrogen ion. If I'm breathing slow, I'm keeping carbon dioxide, and I'm keeping hydrogen ion. And if I keep hydrogen ion, that means I'm going to be acidic. If I'm throwing out hydrogen ions, I'm going to be basic or alkaline. Okay, because there's only two ways to go, left and right. But you guys know on an exam, it's so easy to mess with people. All you have to do is, my patient acidic, basic, both, or neither. And those are compensatory mechanisms, right? That if they break down, you get these problems. So if let's go back to our chart, because that's the easiest way to look at it. So my pH is down. The compensatory mechanism for my respiration, right? If I'm acidic, I want to throw out those hydrogen ions. So I'm going to increase my respiratory rate. And if my pH is up or I'm alkalotic, right? I want to do what? I want to keep the CO2. I want to keep the hydrogen ion. So it'll push my pH back to normal. And that will be a decrease of respiration for an alkalotic patient. Okay. And that is your respiratory compensation. The next compensation is metabolic, and that's chemical. So that's when we deal with the kidneys. And we already know what the kidneys do. They can throw out hydrogen ion in exchange for sodium. So if I have too much hydrogen ion, it can throw it out. If I don't have enough hydrogen ion, it can also retain it. And that's your kidneys function, or your kidney chemical compensation. So you have a lung compensation, and then you have a kidney compensation. So let's look. So we did acid-base balance. Let's look at how you look at an arterial blood gas. All right. Let's look at this video. Now, this is a high yield NCLEX. This is a future NCLEX, but we're going to explain some of this. I think, which one did I use? Did I use this guy or this one? I don't like tic-tac-toe method, but where is the one that I like? Let's go this one. Is this longer?
If you have this and want more peace of mind like this, take charge of your healthcare.
What is going on, guys? Don checking in. Welcome to Mint, where we bring nursing to you. So today we are going to talk about the easiest way to interpret your arterial blood gases. So if you're ready, we're ready. Let's go.
Hello, this is the 3-step ABG interpretation. But before we dive into the actual steps, let us talk about basic concepts that you need to know for this lecture. Starting with, what is ABG? ABG stands for arterial blood gases. Arterial blood gases are simply the measurements of the acidity or alkalinity of the arterial circulation. It also measures gases such as oxygen and carbon dioxide. Now we are going to talk about 4 important components that are in your ABG, and those are your pH, your CO2 or carbon dioxide, your HCO3 or bicarbonate, your PaO2 or oxygen. And we're going to talk about them one by one, starting with your pH. The pH is pretty much the measurement of how acidic or alkalotic the blood is. Your normal value for your pH is 7.35 to 7.45, and we are going to talk about the significance of these numbers later on. Next component would be your PaCO2. Your PaCO2 is pretty much the measurement of carbon.
Now, PA means partial pressure of arterial carbon dioxide. That's what that PA means.
Dioxide. And our normal value for this is 35 to 45. Now, it is easy to remember 35 to 45 because if you look at our pH, your pH is 7.3.
Oh, by the way, you don't need to know the actual numbers for my exam next week, but for future nurses, you really should need to know these numbers.
5 to 7.45. So just remember, 35 to 45 for carbon dioxide. Another concept that I need you guys to remember about PaCO2 or carbon dioxide is that it is being controlled by your lungs. Of course, we breathe out carbon dioxide. Another thing that I want you to relate with carbon dioxide would be acid. Now, I'm not saying that carbon dioxide is an acid. What we're trying to get here is that the amount of carbon dioxide is directly proportional to the number of hydrogen ions being produced, which is related to acid. We're not going to discuss biochemistry here, but all I'm saying is that the more carbon dioxide you have in your blood, the more acidic your blood is. If you look at your normal value here, 35 to 45, if your number is above 45, which indicates that there is more carbon dioxide in your blood, then your blood tends to be on the acidic side. On the other hand, if your value is less than 35, your blood tends to be on the basic side. Next up is your HCO3. Your HCO3 is your bicarbonate. Your normal value for your bicarbonate is 22 to 26. The bicarbonate is being controlled by your kidneys. And just to maintain the pH within the normal range, your lungs and your kidneys tend to work hand in hand to maintain a pH of 7.35 to 7.45. And we will talk about that later on today when we talk about compensation. Earlier, I mentioned that when you see carbon dioxide, relate that with acid. If you see bicarbonate, think about base. The more bicarbonate you have in your blood, the more basic your blood is. If your bicarbonate is more than 26, your blood tends to be on the basic side. On the other hand, if it's less than 22, that means you don't have enough bicarbonate in your blood tends to be on the acidic side. Lastly is your PaO2 or oxygen. This is also being regulated by our lungs, and our normal value for this is 80 to 100. Now, although this is important for us to check when reading our patient's ABG, we don't really need the number when it comes to interpreting whether your patient is having respiratory or metabolic acidosis or alkalosis. This simply will tell us whether your patient is having hypoxemia or not. But am I saying disregard PaO2 all completely? Of course not. Just for the sake of the lecture, when you need to interpret your ABG, whether it's metabolic or respiratory acidosis or alkalosis, you just need to look at your pH, your PaCO2, and your HCO3.
Now, also another reason why they just look at oxygen clearly from a clinical standpoint, it's pretty much straightforward. If it's less than 80, your patient's hypoxemic. If it's more than 100, that means you're taxing, whatever oxygen therapy you're using too much. Okay. Now, most laypersons, most people think that your body senses, or the way your body breathes is the way it senses oxygen, but it doesn't, because when you look at atmospheric oxygen, it's only like 21%. It is the partial pressure of carbon dioxide, especially in the chemoreceptors within your cerebrospinal fluid and your spinal cord. That's what your body really determines on how you breathe. That's why when you think carbon dioxide, think acidic, think hydrogen ions, think lungs. When you think bicarbonate, think base, think kidneys.
Does your patient have hypoxemia? Look at the PaO2. Again, your pH refers to the acidity or alkalinity of your blood, and the normal value is 7.35 to 7.45. Your PaCO2 is your carbon dioxide, which the normal value is 35 to 45. And when you see carbon dioxide, think about acid. HCO3, your bicarbonate, your normal value is 22 to 26. And when you think about bicarbonate, think about base. And lastly, your PaO2, your oxygen, it is 80 to 100. Unfortunately, there is no other way around this but just to memorize these numbers. But if you do memorize these numbers, trust me on this, interpreting ABGs will be a breeze for you guys. Now, let us talk about the actual 3-step ABG interpretation. And these are: identify if it is acidosis or alkalosis by looking at your pH. Identify if it is respiratory or metabolic by looking at your carbon dioxide and bicarbonate. And number 3 would be identify if it is compensated or uncompensated. First step is identifying whether it is acidosis or alkalosis. Again, our normal value for our pH is 7.35 to 7.45. If your pH is less than 7.35, you have acidosis. If it is greater than 7.45, you have alkalosis. Let's see some examples. For a pH of 7.25, it's less than 7.35, so you have acidosis. Another example. pH of 7.55 is greater than 7.45. So what do you have? You have alkalosis.
Now, these separate questions, don't they look like beautiful questions? If you take it all apart, they're beautiful separate questions based on this chapter. That'd be really nice questions for your final exam. For example, I give you a situation like a pH, and you tell me, is it A, acidotic, B, alkalotic, C, both, D, neither? Is it A, a lot of hydrogen ions, B, a lot of hydroxide ions, both, neither? So you could do that with almost every step of this.
Number 2 would be identifying if it is respiratory or metabolic. And we're going to do this by simply looking at your bicarbonate and carbon dioxide and compare that to your pH. Through this, we will know whether you have respiratory or metabolic condition. And the method that we are going to be using will be the concept method. Now, the most common method being taught in nursing school is what we call the row method, where they ask you to use arrows in interpreting your ABGs. However, we will not be using this here because the row method doesn't really work well for compensated ABG. So for now, we are just sticking with the concept method. So what is the concept method? We talked about this earlier already, and that is carbon dioxide is being regulated by your lungs, while the bicarbonate is being regulated by your kidneys. If your carbon dioxide level is abnormal, while this bicarbonate is normal, you have a respiratory condition. On the other hand, if your carbon dioxide is normal while this is abnormal, you have a metabolic condition. And just to throw it out there, remember that carbon dioxide is to acid while bicarbonate is to base. It is best if we use examples for this method. 7.25, PaCO2 of 50, and bicarbonate of 24. Looking at the pH, we can tell that this is acidosis. Our normal is 7.35 to 7.45. It's less than 35, so it is acidosis. Look at the PaCO2. It's elevated. Our normal value is 35 to 45. We have 50. Just by simply looking at that, this is abnormal, and if you look at the bicarbonate, it is normal. Our normal value is 22 to 26. So this is normal, this is abnormal, what do we have? We have a respiratory condition. Therefore, we have respiratory acidosis. And just by simply looking at the PaCO2, 50, that means you went beyond 45. If you have more CO2, your blood is more acidic. So respiratory acidosis makes sense here. And of course,
Now, I could ask the same question as well. I don't even have to put the numbers. I could say my patient has an abnormal PaCO2 and go, what kind? It goes, what kind of problem do they have? You'll answer, it's a respiratory problem. They have abnormal bicarb, it's a metabolic problem. And again, if there's too much CO2, it's respiratory acidosis. Too little CO2, respiratory alkalosis. If they have too much bicarb, that's respiratory alkalosis. Too little bicarb, that's respiratory acidosis. And using the concept method, noting that CO2 you think acid, CO3 base. So too much base, that means I'm too alkaline. And it goes, if it's bicarb, then it's metabolic. So these are because if you get this concept down, your future ABGs will add, which is it's a high valued topic because a lot of people get it wrong because they try to memorize arrows. That Rome method I never learned when I was in school. I just figured stuff out like this. CO2, think what? Acid, lungs. Bicarb, think base, kidneys.
bicarbonate, it's normal. Another example, pH of 7.56, PaCO2 of 28, and bicarbonate of 22. The pH, what does this tell us? Is it acidosis or alkalosis? It's alkalosis. It's more than 45. Looking at the PaCO2, our normal is 35 to 45. It's less than 35 to 45. Look at our bicarbonate. Is this normal? 22 to 26? It's normal. So since your PaCO2 is abnormal, we have a respiratory condition. Therefore, it's respiratory alkalosis. And if you look at the PaCO2, we don't have enough acid in our blood. That means it's making our blood more basic. So respiratory alkalosis will make sense. And of course, our bicarbonate is normal. What about this?
So you could see how in the real world, we can do things. So if I know my patient has respiratory alkalosis and they're on a mechanical ventilator, it goes, what am I going to do? It goes, I could slow down their breathing. I slow down their breathing. They retain CO2 and then it moves the needle more towards the middle instead of the right. So my patient can be normal. Another thing that we can also do, we can compensate using drugs or play around with the kidneys. And we could do that as well. And so if my patient is acidic, I could put an IV of them of bicarb. If my patient's too basic, I can put a line of Ringer's lactate or lactic acid. So you could see how very important ABG interpretation is to our management. And if you get it wrong, we could be doing damage instead of making things better. You can also see how exactly medical management is. We're not gods or goddesses. We don't figure out who lives or dies. We just play around with your chemistry, with what we know about anatomy, physiology, chemistry, pathology, and we do these things to you, whether it's drugs or play around with your mechanical ventilator, or give you drugs that'll mess with your kidneys, to make you back to what? The pH of between 7.35 and 7.45. Here's another example.
7.25, PaCO2 of 37, and bicarbonate of 21. Looking at our pH, is this acidosis or alkalosis? It is acidosis. Looking at our PaCO2, our normal is 35 to 45. So this is normal. Looking at our bicarbonate, our normal is 22 to 26. Since our abnormal is the bicarbonate and the CO2 is normal, do you have a metabolic or a respiratory? We have a metabolic condition. And since this is acidosis, we have metabolic acidosis. Think about this for a second. Our normal is 22 to 26. We don't have enough base in our blood. That means our blood is more on the acidic side. So metabolic acidosis does make sense. Another example.
So you can see how they use the concept method, meaning if I don't have enough base, I have to be acidotic. If I have too much base, I have to be alkalotic or alkaline or basic. If I have too much acid, of course, acidotic. If I don't have enough acid, I'm now alkalotic, right? And of course, if it's CO2, think respiratory, bicarb, think metabolic. Let's go over one more example, but I think you got, I hope you guys got it, or let's just go over one more example and see if you answer it on your own, and then we'll talk about it, and then maybe give you guys some random examples from the internet.
7.56, we have 44 carbon dioxide and bicarbonate of 35. Looking at the pH, we have alkalosis. Our PaCO2, it's normal. Our normal is 35 to 45. And our bicarbonate is 35. Since our abnormal is bicarbonate and the CO2 is normal, we have a metabolic condition. And we relate that with our pH. We have a metabolic alkalosis. And this makes sense because the more bicarbonate you have, the more basic your blood is. Now, you guys might be wondering, what if your PaCO2 is abnormal and your bicarbonate is abnormal? Or what if your pH is normal and both of them are abnormal? You have to remember that the examples that we just used just now, these are examples of uncompensated ABGs. If your pH becomes normal and both of them are abnormal, we have compensation going on. We're going to talk about that in step number 3, which is identifying whether it is compensated or uncompensated. My twin brother Ben will be explaining more about this. So Ben, take it away.
Thank you, Don. So we have learned steps 1 and step 2 of reading ABGs. Step number 3
All right,
is
let's stop
identifying.
because it's getting it's beyond our scope, but I'm going to have this video available as well. But you could also see regarding compensation. Remember, if you have full or partial compensation, your pH is normal, and both your CO2 and bicarb will be abnormal. Okay, but for our purposes, the worst I could do to you is this. I'll give you a pH and I'll tell you if it's high or low. If it's, of course, high, right, greater than 7.45, then it's got to be what? Basic, or alkaline. If it's less than 7.35, my patient has to be acidic. If I ask you about CO2, you're going to say lungs. So that's the compensatory mechanism. If I ask about bicarbonate, it is the kidneys, which is the compensatory mechanism. CO2 deals with the amount of acid. If I got a lot of CO2, I got a lot of acid, therefore acidotic. If I don't have a lot of CO2, less than 35, I'm what? Alkalotic. And that's the concept method, knowing and understanding what these things mean. And of course, bicarbonate, we already know that bicarbonate is a buffer and it's a base. So if I have too much bicarbonate, right, that's my kidneys, and that is a metabolic compensation. If I have too much bicarbonate, therefore it's too much base, I'll be alkalotic. And if I don't have enough, less than 22, then I'll be acidic. And remember, your PaO2 is everything on the is used like on the outside of the ABG, and that just tells us if we have hypoxemia or not. It should be around 80 to 100. If it's less than 80, you have hypoxemia. If it's closer to the upper end of 100 and above, that means my respiratory care or my respiratory management is going overboard. I'm putting way too much oxygen through my patient, and if we do that, it'll dry out your patient and cause a whole bunch of other problems. So when we're looking at this, because this is a wonderful overview of what an arterial blood gas can tell us, and you could see how it clearly relates to the things that we are talking about today. So we now know that there are two compensations: your lungs, CO2, your kidneys, that's your metabolic compensation, that's bicarbonate, and of course pH dictates whether if you're acidic or alkalinic, and pH is actually the negative log of the concentration of the hydrogen ion, which means if it's less than 7.35, you're acidic. Greater than 7.45, you are basic or alkalotic. Now, I like using the terms, let me just keep this, because I'm going to put that in our announcements. But if we look at what we have to do this week, and since you have exams next week, lesson 9 is on me. Don't do lesson 9. If you did it already, well, good on you. I'll use it for extra credit. Just do your concept map for task 9, and don't do your discussion either. That'll be my present for you guys. Just do task 9 for next week and study for your exam. Now, let's look at, did we go over everything? Did we go over what a pH is? Yes. Did we go over acidosis and alkalosis, both respiratory and metabolic? Yes. Did we go acid-base balance? We talked about buffers, how your body compensates and corrects it. Yes, we did. And that's all that stuff. So it is at this point, I'm going to stop the recording.